There we go. Good evening, ladies and gentlemen. Welcome back to the Extraordinary Technology Conference 2017. Tonight, I'm going to be presenting to you a first-time speaker, Dr. Carolyn McMakin. She hails from Portland, Oregon. She has a bachelor's degree and a master's degree in psychology. At 40, she went back to pre-med and started chiropractic school at 42. She has 8 published papers, 2 books, one of which, Frequency-Specific Microcurrent and Pain Management, and the other, The Resonance Effect, both of which are available out there on her table. Tonight, she'll be presenting on the extraordinary resonance effects in clinical practice. And so I would like you to all give a warm welcome to Carolyn.
Thank you very much. That was lovely. Hi there. He forgot to ask for hands of people who've never been here. So this is my first time. I met Tom. Hi. So there are other first-timers. Can we turn the mic down just a little bit? It's a little bit hot. Other first-timers, yay. Are you having a good time? Cool. Are there any medical professionals of any sort in the office? 1, 2, 3, 4. Yay. Okay. That's who I'm used to talking to. So if my presentation style doesn't quite match your listening style, give me a chance and we'll get caught up and we'll do Q&A at the end. For some reason they seem to expect me to go over a bit because they keep saying there's nobody after you. So I figure everybody's gluteal tolerance is around 60. They told me originally I had 60, 90 minutes. So let's get going. So here's the question. What would happen to your health and everybody's health if you could reduce inflammation, dissolve scar tissue, kill viruses, eliminate pain, increase healing and cellular energy, all pretty quickly, without drugs, without supplements, without a lot of time? What would happen? Well, I'm not sure about free. Everybody gets dead. But yeah, it would change everything, and it changes the paradigm of what we're able to do in medicine, health, and healing. The thing that frequency-specific microcurrent has done is that. Frequency-specific microcurrent has been doing that very thing. What you saw on that slide, this is what we do. Not just me, but the 3,000 or 4,000 people that I've trained and that use frequency-specific microcurrent in 13 countries around the world. And we do it within a medical model. It's why I've never presented at this meeting. If you're going to take the resonance effect and a frequency response and energy medicine into the mainstream, you lecture at NIH, you lecture at the American Academy of Pain Management, you lecture at the Institute for Functional Medicine. So forgive me if this is my first time to hang out with you guys, but you are my people. You understand what this is about. So we've been doing this with frequencies. So the frequencies were developed in the early 1900s and used by thousands of physicians until 1934. Harry Van Gelder was an osteopath and naturopath from Australia who bought a practice in Vancouver, BC in 1946 that came with a machine that was created in 1922, and that machine came with a list of frequencies that were created in 1922. So 1910, the Flexner Report came out, and the American Medical Association, by about 1925, got serious and said that anybody that used herbs, homeopathy, supplements, or electromagnetic therapies would lose their license to practice, which at that time was granted by the AMA. And drugs and surgery was the way that medicine was going to go. We were going to have medical schools. We were all going to think about this in the same way, and these are our tools. And what went away in 1934, 1925, they got serious about it. Took them about 10 years to lock everybody down. Herbs, homeopathy, supplements, nutrition, and electromagnetic therapies. The machines went in the back room, got covered up by a sheet. Obviously, this group knows what they did to Rife in the 30s. And that all served as a cautionary tale for me when I first developed frequency-specific microcurrent. So I got this list in 1995. I got it from George Douglas, who's a chiropractor, who interned with Harry Van Gelder in 1981. So Harry walked into this clinic in Vancouver, BC, walked into the back room, pulled this sheet off this lumpy thing and said, "What's that?" Now he's a Dutchman, so you know he said it a little more exuberantly than that. "So what's that?" And he taught himself to use the device and the frequencies, plus osteopathic adjusting, plus acupuncture, plus nutrition, plus homeopathy. He used them all together. And Harry was famous in Canada and the western half of the United States. When the word got out that I had Harry's frequency list, I saw patients who were in their late 50s that he had treated when they were in their teens. One guy he cured of kidney cancer, another one ocular cancer. Those of you that understand cancer know that kidney cancer doesn't get better most of the time. And so that was Harry Van Gelder. So I got this list from Harry in 1995, plus a lot of Harry's stories about the things he did with it and how the machines were used and how the frequencies were used, and his model for how you use the frequencies and how you approach all illness and disease and dysfunction with the frequencies. That served as a platform from what we did as we went forward. So I resurrected the list in 1995, and as you'll read in the resonance effect, what I started with was myofascial pain. I started with a guy that had trigger points in his SCM that made him dizzy when he tipped his head forward and turned it to the right. What, am I okay out here? So the problem was when this guy tipped his head forward and turned it actually to the left, he got dizzy. The problem was he had a train car on a 20-foot cable because he was a crane operator in a shipyard. And when he got dizzy, people got nervous. So he had an auto accident. I'd been treating him for 2 months with my well-trained, trusty thumbs. And I wouldn't get much of it anywhere. And the next day he was going to see a neurologist that was going to take him off of work and a job that he loved. And it's like, well, okay. So I had the frequency list on a cart. I had these graphite gloves that we used to conduct the current, and I put those graphite gloves on his neck, and for the first time ever, I had the list, right? And there's a frequency for minerals, and there's frequency for fascia. For the technology requires frequency for a tissue on what we call channel B, and a frequency for condition on channel A. And there are enough engineers and physicists and biophysicists in the room that you all know that when you run two frequencies simultaneously, what you get in the middle, where they mix, is a frequency from A, the frequency from B, the sum of the two frequencies, and the difference between the two frequencies. That's how this system works. Tissue, condition. What tissue is it? What's wrong with it? Well, those of you that have myofascial trigger points know that it's hard. It's got calcium influx, right? So I ran mineral deposits in the fascia. And his neck turned to pudding. And there was this, huh? Really? And that was it. One more session, he was done. And I've been trying to do this for 2 months with my hands. So that's where I started, by accident, in January of 1995. Through 1995, I worked with Dr. Douglas, and we went through Harry's list, and I had a myofascial pain and chronic fatigue and chronic illness practice. My whole practice for 20 years has been the 5% of patients that nobody else can fix. So it was really pretty straightforward. So we worked together with Harry's list. All of 95, 96, I put the graphite gloves on my hand, treated the longshoreman, and through 96, started treating chronic myofascial pain patients. 97, I decided that we needed to teach it to find out if it was reproducible, because this was too good to be true. You know, when it's too good to be true, sometimes it's true and sometimes it's not. I'm a scientist. That's how I roll. I am an open-minded skeptic, if that makes sense. And so it's like, okay, is this for real? So we did everything we could in the clinic without teaching it to classify that, to figure that out. We had the machine not face me. I didn't put the frequencies in. Patients were treated in different times of the day in different rooms by me or my assistant. We did everything we could to blind everybody. The only way to do it then in 1997 was to teach it to find out if it was reproducible. If I could teach a naturopathic student or a chiropractic student or a chiropractor to do it, anybody could do it, right? So January 17th of 1997, we taught the first class. By June of 97, we knew it was reproducible, and I have kept teaching it for the last 20 years because it would be immoral not to. What you're going to see in the next 75, 80 minutes are case reports that are the tip of the iceberg. What is possible when frequencies are applied thoughtfully, consistently, within a diagnostic appreciation of what's going on at a cellular or a tissue level is incredibly powerful. So just to get this out in the open, I have no idea where this list came from. Not the faintest clue. In 1934, when they threatened these guys with the loss of their licenses and the machines went in the back room and then Dad died and then Grandpa died and then somebody died and the machines went on the junk heap. Any of you that have buried your parents or grandparents, you know what happens to the stuff in Grandpa's house and Grandpa's office, right? It goes away. So all of that science, Electromedical Digest, the Pathometric Society, all of the societies that were present in that day that did this original research starting in about 1908, 1910, all of that's gone. And anybody that says they know exactly where the frequencies is coming from, I'd love to see the data, because I don't believe it. We looked. It's just gone. So basically, I'm a clinician, I'm a fix-it guy. I fix stuff. And it either works or it doesn't, and if it doesn't work, I don't teach it anymore and I don't use it anymore. If it does work, I teach it and we see if it's reproducible and we try and fine-tune it. So I don't really care where they came from or how they did it. So that's just being upfront. Mechanism of action, we actually have, and you'll see towards the end, we have a pretty good idea about mechanism of action. But I can tell you the 1920s equipment was not microcurrent. It was plug in the wall. When wall current was DC, it was direct current. Okay? By the time the machines were out in the 50s, I actually have never seen the machine that Harry used. I got the list. And the list said 40 hertz is the frequency for inflammation, and we assumed that that was to reduce inflammation because nobody in their right mind would want to increase it. So you want to take away inflammation, you want to take away scar tissue, you want to take away toxicity. And that's the list. So let's go through and show what we're able to do with it. So this is the basic FDA disclaimer. FSM, frequency-specific microcurrent, that would be me, does not make any claims about being able to diagnose, cure, mitigate, treat, or prevent any condition of disease. The use of frequencies as a therapeutic tool has not been evaluated by the FDA. And that's just fine. I am just fine with being able to treat trigger points in somebody's low back. Now, we treated the facets, that didn't work. Treated with frequencies for the disc, and that didn't work. The guy just got off a plane from Washington, D.C. 2 days ago, and he's had this awful, wicked back pain. He bench presses 150 pounds, and his suitcases weighs 40. Is this a mechanical low back injury? Everybody shake your head no. It's not a mechanical low back injury, and facets didn't work, and muscles didn't work, and discs didn't work. So what is it? When your back hurts right here, what is it? It's kidney stone. So I ran the frequency for kidney stone pain, and all of his back pain and muscle spasm literally went away. They're just done. 20 hertz on channel A, 60 hertz on channel B, it's done. Did I do anything to his ureter or his kidney stone? No. FDA or the chiropractic examiner's office comes into my office and said, "What did you do?" I said, "I treated the trigger points and the muscle spasm in this man's back." "How'd you do that?" 20 hertz on channel A and 60 hertz on channel B. What does that mean? That means his muscle spasm and trigger points went away. All of this is fine as long as you don't feel compelled to make any claims. I don't have to prove anything to anybody. So that's the distinction. And even though we all know what this is about, as a clinician, I can present my clinical results and data in any venue I want to anybody I want. And that's what I'm doing, okay? The way I've stayed in business for 20 years and the way I survived 14 hours of interviews with the FDA when they came looking for me 7 years ago, and the way I survived 12 pages of affidavit was by this. You play by the rules, you do what you're supposed to do, you don't make outrageous claims. The devices are approved in the category of TENS devices. Now, it's 1,000 times less current than TENS, and it's totally not a TENS, works by a completely different mechanism, but the only claim for the devices is pain claims. It's to treat pain. So anything I do that treats pain, I'm just fine. However, as you'll find in the next 60 minutes, FSM is not about the box. I don't have a gadget. I don't have a gadget you can buy without taking the training. It's like giving an Uzi to a 3-year-old. Not in my time. You want to buy a machine, you take a class. The class is 4 days. Buckle up. So here's the problems we all have, right? So there's healing injuries, post-operative healing, and healing wounds. Now, the problem in humans is ATP production. How do you increase cellular energy? How do you increase blood vessel flow? If you're going to create healthy repair tissue, it has to have blood supply. So that's vascularity. How do you increase collagen and elastin? Well, what would happen to everything that we do in healing if you could increase cellular energy and ATP, adenosine triphosphate, it's the cellular chemical energy that the body uses, by 500%. That's just the data. In 1982, Nak Cheng is a PhD, I'm not sure what area, but he found that 10 to 500 micrograms applied to rat skin in tissue culture increased ATP production by 500% in rat skin. That increased protein synthesis, and that increased amino acid transport. If you're going to build proteins, you've got to transport amino acids. If you have all this extra energy, you can kind of see the cell saying, well, I don't know, we got all this extra stuff, what do you want to do with it? I don't know. Let's build protein with it. Amino acid transport by 40%, and then Seegers reproduced this in 2001, 2002, and she did it in vivo and in vitro because she did it in live tissue culture. And it was still a 500% increase in ATP production. I saw a hand raise. It's really hard to see with the lights, and what I'm going to ask is that we'll save your questions, and we'll do it at the end. Just don't forget, because I'll probably like the questions. I'm sorry? Okay, at the end, we'll go to the mic so it can go on tape. So that's what we know about healing. So the devices are approved in the category of TENS. Now this is the 3 devices that Precision Distributing makes. There's lots of microcurrent devices out there. You can do your thing. All it needs to be is millionths of an amp. It's not actually TENS. It's billed as TENS for those of you that do physical medicine and can bill for it. The devices are either DC, direct current, or pulsed DC. There are different waveforms, sine wave, square wave, ramp square wave, H wave. People make all sorts of claims about their waveform. Whatever. I have been treated by various ones. I'm not convinced. What we know for FSM is that sine waves don't work. We tried it. I bought a machine. I used sine waves for 8 days. They don't work. All the frequency effects that we'd had, it doesn't work. So if you're going to use a microcurrent machine, make sure it is a square wave generator or a ramp square wave. There are devices with 1 channel. To do frequency-specific microcurrent, you need 2 channels. There are combined units that have ultrasound, interferential, galvanic, and microcurrent. Those tend to be single-channel, single-frequency units, and the frequency is generally not important. They either do a limited number, there's some people here are familiar with the Accuscope. It does a sweep from 1 to 1,000, and then when the galvanic skin response changes, when the conductivity changes, it will pause on that frequency until the conductivity comes back up to normal, and then it'll go back onto its sweep. So it's one channel, it does a sweep, and the device decides what you use and what it's going to use. Okay? So it's an entirely different system. So just the current, this is in bunnies at University of Washington, increased, so this is 5 days a week for 4 weeks, 5 days a week for 4 weeks is what happens when you give a graduate student a project so he can finish his thesis. That's what this is. They biopsy the bunny, treat him 5 days a week with just 0.3 of a hertz, just current flow, no frequencies. Increased vascularity by 39%, so the blood supply was great. Increased collagen by 14%, and that's these little black lines. Increased elastin by 48%, which is amazing. The problem with scar tissue and repair tissue is it's not stretchy. It doesn't stretch. So the next place you get injured is going to be right next to that stiff, unstretchy place that just healed from this last injury. Those of you that have had the same injury in right next to each other will understand that. So to increase elastin means that not only was the collagen laid down stretchy, it was combined with elastin in such a way that it was functional. And that's what everybody cares about. So you got to ask, what would happen to injury and wound healing outcomes if you could increase ATP vascularity, collagen, and elastin? Well, that's a given, right? Makes perfect sense. What we found through clinical practice is that the frequency effect makes a huge difference in healing. Unmodulated microcurrent, just the current by itself, and there are two separate effects that we're talking about. Just the current, just a pulsed EMF field that's not specific. Just that will increase ATP production and improve wound healing. But the frequencies add, in my experience, an additional dimension to healing and tissue repair that makes a huge difference. So we actually have a control trial. And this was done by one of our practitioners in Ireland. It's Denise Curtis. It was compared, they had the patients exercise their hamstrings to the point where they would be sore the next day. They used one machine that was on, one machine that was off, because the current is subsensory. Can't feel it. It's a perfect research tool. Patient can't tell whether they're being treated or not. You can leave the machine on, and if it's off, and if it's a placebo effect, you'll know it. So placebo leg, active leg, and it was a 20-minute treatment. And Alan did a similar study in 1999 with just 0.3 of a hertz and 30 hertz applied at 200 microamps for 20 minutes, okay? And we did the same, Denise Curtis did the same protocol, 20 minutes immediately following exercise using our frequencies. 18 is the frequency to stop bleeding, 60 hertz is the frequency for the arteries. Torn and broken actually repairs partial thickness tendon tears. In the blood supply, the fascia and the tendon, reduce inflammation, 40 and 116, 40 inflammation, reduce inflammation in the muscle belly, the fascia, the tendon, and then support vitality, whatever you think that is. And that's the protocol, okay? Now, somebody asked me out at the booth, well, do you tell people what your frequencies are? It's like, well, duh, yeah. It's no good if, I don't want to sell you a box. I want to teach you to save lives. I want to teach you to change lives. I want to teach you to make a difference using resonance therapy, using frequency-specific microcurrent to change people's lives in a profound way. And the only way I'm going to do that is to teach you the language, what to do, what to not do, and that's what it takes 4 days to tell you. So that's the frequencies we use, and this is what happened. Any statisticians in the group? Anybody who's ever had statistics? Okay, you know what that p-value means? Yeah. So the treated leg, now this is a sham leg, after 24 hours the sham leg pain level was a 5 out of 10. Treated leg is a 1.3 out of 10 instead of a 5. At 48 hours you know that that's when it's the worst, and the pain level was a 7 out of 10. With the treated leg it was a 1 out of 10. By the second day they knew which leg had been treated and which leg had the sham. And then at 72 hours, the pain level was less than 1, and the sham leg, poor thing, was still at a 4. The p-value is the measure of statistical significance. This study only had 20 patients. an N of 20 with a p-value with 3 zeros is almost impossible with any other medical therapy. So the two statisticians are nodding their head. That makes me feel good. So this was published by Denise Curtis in the group. This is a 4-hour window. There is an effect that happens when somebody is treated within 4 hours of the time of the injury. This was a 30-year-old, a 36-year-old woman. She was a podiatrist by profession, but a ballerina with the Portland Ballet Company as her hobby. She was hit side impact at 30 miles an hour while she was driving the minivan after she dropped the kids off at school. She called me at 8:30 in the morning. Like it tipped over, hit her at 30 miles an hour just behind the driver's side door, tipped the van over. She got out of the car, she called her husband, she called the ambulance, and she called me. And I said, get here whenever you get out of the ER. So when she arrived at my office at 11:30, she knew nothing was broken because they'd done x-rays. When she arrived, she had pain from here to there, so from her cheekbones down to just below her collarbone and in between her shoulder blades. She had 20 degrees of motion instead of 90 in all directions, and her pain level was a 7. Okay, she had maybe 14% body fat as a ballerina. So you could see the swelling in the muscles in her neck. And so she got there at 11:30. The history took till 12:30. So now we're at 4 hours after the accident. She got treated from 12:30 to 2:30, actually probably closer to 3. So 2.5 hours of treatment, 4 hours after the accident. At the end of the treatment, I told her, I want you to come back tomorrow. I got to warn you, you're going to be worse tomorrow than you are today. You're going to be worse Saturday than you are tomorrow, and you're probably going to be worse Sunday. You're going to be off work for 4 weeks, and this is a 3-month injury. A 30-mile-an-hour side impact accident is huge, okay? She came back in the next day completely pain-free with full range of motion. And it was like the sun came up in the west. Excuse me? Are you sure? Nothing hurts anywhere? She said, no, I'm fine. I said, well, maybe it'll come back Monday? I'd never done anything like that, right? So she came back Monday, still pain-free, full range of motion. It was done. And that is one of those things you put up on the shelf with things I don't really understand. I'm not sure I believe, and I'll see if I can do it again. So this is where we came up to the first model for what we think we might be doing with frequency-specific microcurrent. The only thing that is characteristic, and this was put together by one of our practitioners in Australia, Diana Cross, she's a GP in South Australia. So the only thing that happens in the first 4 to 8 hours, and this 4-hour window can be stretched to 8, but if you get them after 8 to 10 hours, you can improve things, but it's not like Shazam, it's not magic. So what happens is that there are genes that are turned on in the first 4 hours that turn off between the 4 and 8 hour mark. What we have come to believe, and I finally have the chance this summer to test this, is that the frequencies are changing cell signaling in such a way as to turn off or change genetic expression inside the cell. We're close. I finally have a patient coming up with an Achilles tendinopathy that we can fix in about 2 hours, and he is an MD, and he can do a blood draw before and after in his office. So, but that's what we think we're doing, is changing the genes. This is my most, I would say, high stakes, impossible, and well-known 4-hour window patient. Terrell Owens, I treated him when he was with San Francisco in 2003. They called me in December of 2004 on Monday. His personal trainer called me and said, Terrell was hurt yesterday. He tore up his lower leg and broke his fibula, and he wants to play in the Super Bowl in 6 weeks. And his chiropractor, Mike Hatrack, says if anybody's going to do it, you're going to have to do it because he's not going to even try. And he said, can he play in the Super Bowl in 6 weeks? And it's like, oh my God. Well, you do the math in your head, and yes, but I have to be there as soon as he gets out of surgery. Surgery was 7:30 the next morning. So between 10 o'clock in the morning when Buddy called and 8, 9 o'clock that night when I climbed on a plane, I found somebody to watch my kids. I canceled patients for a week, and I climbed on a red eye. I'm 70 years old. I don't do red eyes. And this was 13 years ago, so it's like, I got off the plane in Philadelphia. They picked me up, took me to the hospital, and he's rolling out of recovery in this wheelchair, waving to the nurses. He's a really nice kid. And I started treating him in the car on the way home. We had 5 weeks, really, to fix an injury that everybody in the business knows is career-ending, and at least 18 weeks. It is not something you do in 5 weeks. So I treated him in the car on the way home, hooked him up, took about an hour, hooked him up, took him off, crutched him into the house. He lays down on the couch, sleeps off the anesthesia. I hook him back up, and I treated him for 24 hours straight. At about 8 o'clock that night, I turned the current down to about 20 to 30 microamps because I was going to be treating him all night. It was an old blue box. I had nothing automated at that point. I sat up on the couch. I punched buttons every time I woke up. You treat to stop the bleeding. If you can stop the bleeding and treat the tissue to remove the effects of trauma and quiet down the nerves and quiet down the inflammation, the thing will heal. So the next morning, the team trainer came in, and he said, as Rick Burkholder, he said, okay, let's see it. Now, you take off the boot and you take off the ACE wrap, and what everybody in Terrell and Burkholder both know what to see, they expect, right? It's going to be black and purple. It's going to be about that big and be bruised clear down to and swollen down to the sole of his foot. So we take off the boot, unwrap, cut the bandage, unwrap it, look at the other foot. No, that's the foot. There's pins and stitches, but there was 0 bruising. We're at the 24-hour mark. 0 bruising, 0 swelling. And Burkholder he was quiet for close to a minute. And he looked at me and he said, how do I take advantage of what you can do? I said, this is a smart man. This guy I can work with. And he said, you're going to have to believe what you see, not what you expect to see, because I've never done anything like this before. He said, okay, make it happen. So I treated him 12 hours that day, 6 hours a day. For 4 or 5 weeks, the fracture was completely healed. He had an open spiral fracture in his fibula. It was healed bone to bone in 4 weeks. That's impossible. Ligaments in his ankle were completely avulsed. The deltoid ligament was just hanging. They kind of paste it down. They don't even stitch it. That one was completely stable, and the bones were healed on fluoroscopy and x-ray at 4 weeks. And there are frequencies, as you're going to see, there are frequencies to dissolve scar tissue. At 4 weeks, we could use the frequencies maybe for mineral deposits, but I was so nervous, if we took out too much scar tissue, I didn't have time to put it back. You understand? So when he got to Jacksonville 5 days before the Super Bowl, he couldn't run. He trained, Burkholder had him in the pool on a treadmill 3 days after this surgery. I came back to the house 7 days, 1 week. So I went home, had Christmas, flew back the following Monday, and he is in sneakers chasing his girlfriend around the front yard in the snow, having a snowball fight. Weight bearing on that ankle. Okay, so we get to Jacksonville, he can't, so he's aerobically fit. They've kept all that happening, but we haven't taken apart the scar tissue. And the nerves are glued to the fascia. And so he got there Tuesday, ran 20 yards, it cramped up. I got there Wednesday, and Burkholder said, he can't run. I said, it's just scar tissue, we'll fix it. So Brian Glotzbach is his massage therapist, and Brian and I, down in the bowels of the stadium, in a concrete bunker room with a massage table, started taking apart his leg. We worked on him for 4.5 hours. And Brian still describes it as bloodless surgery. We dissolved 6 weeks worth of scar tissue in 4 hours. And at the end of it, he could run. The next day, we treated him again for another hour and a half, 2 hours. Hat rack came in and adjusted this $6 million ankle. Bam! That was it. Friday, he ran like he'd never been hurt. Sunday, he ran for I don't know how many touchdowns, 157 yards, caught a bunch of passes. It was an amazing experience. But this is what's possible. Now, this is like working on a Ferrari. This kid eats no wheat. He gets beef 1 day a week, fish, salmon preferably, halibut, chicken, rice, broccoli, nothing fried. These guys are like finely tuned nutritional machines. There are no potato chips, right? And he slept in his hyperbaric chamber. He did all the other things, and he was motivated. But this is what's possible when you have frequencies to stop bleeding and reduce inflammation. And we have units and trained people we've got units with 10 NFL teams, 2, 3, 4 NHL teams, and 1 baseball league. So, this is just an example. Facelift. She had a brow, mid-face, and basically a facelift and eyes. This is her at day 1. They pack them at ice, they put in drains. Day 2, day 4, day 5. She's still a little bit puffy. 80-minute treatments immediately post-op and every day for 7 days. Day 6, day 9. This is day 11. Anybody ever seen anybody after they've had a facelift? They don't look like this for 3 to 4 months. Okay? This is a brown rectospite, and these are the frequencies I treated him with. This is my husband. July 20th, he got bit by a brown recluse spider, diagnosed. MD said, it's going to necrose, we're going to need to do surgery and debride it, come back in a couple of weeks. Okay, keep it clean, keep it dry. 1 treatment, about an hour. 2nd treatment. Do you see the difference? This is all black and clotted, right? So the recluse spider dissolves the blood supply basically, and the tissue gets necrotic. You see here where it's lacy around the edges, and there's just this central spot. 23rd. Now this was really fun because the frequency, see these blood clots? This is dark red here. There's frequency for dissolving the blood clots, 284. There's frequency for the blood supply, 62. Arteries. Used 284 and the thing started bleeding. Right where the bites were, there were 4 little hemorrhages. This started bleeding, turned bright red. We ran the frequency to stop the bleeding. And once the bleeding stopped, he's like, want to do it again? So we stopped the bleeding and started the bleeding and then finally settled that down. But look what happened when you got rid of the clots and treated the necrosis. Do you see how small it is? How lacy it is? I don't know how well it shows up. Well, this is, 10 days? And it's completely done. This guy's 80 years old, right? Postoperative outcomes. John Cale is an OBGYN. He does C-sections, and he did effectively a control trial. He kept track of his outcomes and compared them with C-sections that other physicians plus himself had done in the hospital without FSM. And his patients got out of the hospital in 2.9 days. Control patients, non-treated FSM, got out in about 3.5 days. Post-op pain, 0.5, less than a 1. Easy peasy, at rest. Pain levels of 2. Activity, pain. They want you to go walk when you have a C. Anybody here ever have a C-section? How about an appendix? The guys, hernia surgery, and they tell you to get up and walk, and that's the part where you laugh a lot, except it hurts to laugh, right? So activity, pain level is a 5, but with FSM it's a 3. This is diabetic ulcers, diabetic wounds. 7-centimeter ulcer on the, I don't know if you can see it, medial aspect of this left leg. There's a huge ulcer there. It's about 7 centimeters long. It's about 5 millimeters deep. And it was healed in 9 days. 6 treatments in 3 weeks. Well, that's 21 days. But basically, there was closure at 9 days. Necrosis in the 3rd digit. That's this toe. But this is the one. They told him, it's like, wait another month or 2 and we'll just take off that one and the one next to it. You know, it's gone, it's done. And it was completely healed in 12 treatments. Peripheral neuropathy, his feet were numb and painful, 7 out of 10 test areas, 4 weeks. 8 treatments twice a week. And it's not like his blood sugar control is great. If they're cooperative and their blood sugar stays under 100, 110 even, this happens a lot faster and it stays a lot better. So that's what's possible in wound healing. This isn't just numbers. This isn't ATP. This is problems in medicine and in everybody's health. Inflammation, degenerative diseases, immune system activation, including autoimmune diseases. Anti-inflammatory drugs is what we have, right? Or diet or curcumin or whatever. The problem with anti-inflammatory drugs, which is what most people use, is they take too long. You know, Advil will take away your headache in about 2 to 4 hours, but if you've got something serious going on, it takes 3 to 5 days for Celebrex or some other agent to work. Too many side effects on your on your ears, on your kidneys, on your blood vessels, on your heart. The NSAIDs, the non-steroidal anti-inflammatories, block prostaglandins, and the problem is they block all of them. The prostaglandins are responsible for rebuilding the lining in your gut. They're responsible for repairing the blood vessel walls. It's not a coincidence that Celebrex increased heart attacks. It blocks the prostaglandins that rebuild the blood vessel linings in the cardiac arteries. It's like, oh well, we're going to treat you with Celebrex because that helps take away your joint pain. And the challenge, I actually met somebody here that's familiar with cytokine chemistry. Cytokines, which are the inflammatory peptides that are characteristic or elevated in all sorts of inflammatory diseases, are hard to change. They don't change easily. So what would happen to inflammation, to this problem in your life, your friend's life, your mother's life, your daughter's life, your son's life? What would happen if you could reduce lipoxygenase-mediated inflammation by 62% in 4 minutes and cyclooxygenase-mediated inflammation by 30% in 4 minutes? That doesn't sound as good, but that's equivalent to injectable Toradol, which is what they give you by injection when you've had your hips replaced. Okay? That's what they use after surgery. Well, that's kind of blurry. FSM blinded animal research. When I taught this class in Australia, Vivian Reeve is a researcher at University of Sydney University of Australia in Sydney, University of Sydney, Veterinary Science Department. If you have an anti-inflammatory drug that you want released by the Australian TGA, it has to go through Vivian's lab, okay? So she had a standardized model for testing anti-inflammatory agents. She had tested every NSAID on the market in Australia by doing this over the last 18 years. So the technique is very low tech. You paint arachidonic acid on the mouse's ears, and then you do something to the mouse. You give him a drug, you do this, you do that. What happens to the swelling? So Wayne Riley is the guy holding this mouse. He's got him by the tail and he's got him by the scruff of the neck. And these are graphite gloves, which is what we used to use to conduct the current. I guess we still do. And this is a Precision Micro, the old analog, what we call the blue box. 8 D-cell batteries. And Wayne grabbed onto the mouse and he treated 10 mice. And the inflammation in the mouse's ears dropped by 70% in all the mice as an average. Vivian went in and looked at the data and said, yeah, y'all go home. She shut down the lab, came everybody back the next day, and she moved the people that were painting the mice into one room, closed the door. People that were treating the mice, Wayne, into another room, closed the door, went in with him and turned the machine away from him so he couldn't see, and put in a placebo frequency. And then she moved the people that were measuring the mice into a third room, so nobody knew what anybody else was doing. Because in 18 years of doing this kind of research, she had never tested any prescription or non-prescription drug that reduced inflammation by more than 45%. To find any agent that reduced inflammation by 70% in 4 minutes in every animal tested was, you guys got to be cheating. So they did it all really carefully, and it was 62% reduction in LOX-mediated. Lipoxygenase-mediated inflammation is what creates havoc when you have irritable bowel, Crohn's, asthma, bronchiectasis, COPD, and various neurodegenerative diseases. LOX is the enemy. COX you're all familiar with because that's what gives you joint pain. 30% reduction in COX-mediated, which is equivalent to injectable Toradol when it was tested by the same researcher in the same animal model. All animals responded, and this was the first place we found out it's a 4-minute time-dependent response. Half the effect is present at 2 minutes, full effect is present at 4 minutes. We're not sure what that means. It's just a data point. She tested 3 other frequency combinations. 1/10 of a hertz. Does microcurrent by itself, in addition to increasing ATP, does microcurrent by itself reduce inflammation? No. Just no. Any other frequencies? So they tested 2 other sets of our frequencies. Any other frequency reduce inflammation? No. All equivalent to placebo. Nothing works but 40 hertz on A and 116 hertz on B. Then you got to feel sorry for the little mice, but we're going to just kind of move past the feeling sorry for the mice part at this point, okay? So you sunburn the mice. Now these are little hairless mice, and we're all assuming that they're going to retire to an old age mouse home on Tasmania. They have nice beaches there. It's a good place for mice. Anyway, back to the mice. So you sunburn the mice, and this is what happens when you sunburn a mouse. You've all had sunburns, right? So it swells, it gets red, it's inflamed. And this is no treatment at 21, 23, 25, and 27 hours. When the mice were treated immediately after the sunburn with 40 and 116, reduce inflammation, 116 is a frequency for the immune system. They had some reduction in swelling, but it just wasn't very impressive, and it wasn't statistically significant. They treated them at 2 hours treated them at 2 hours, and that group had a statistically significant decrease in swelling at 21, 23, 25, and 27 hours, okay? Then here's, this section is a little bit tricky, but stick with me. Sunburn suppresses the immune system. I didn't know that before Vivian told me. That's actually why sun exposure works in psoriasis. It suppresses immune system response. You want to get rid of psoriasis, go sit in the sun, in Phoenix preferably, or maybe Albuquerque. So at the time of the sunburn, they paint a contact sensitizing agent on the hind leg just before they sunburn the mouse, okay? 2 weeks later, the same agent was painted on the ear. This is a substance to which you should develop an immune system response, okay? Normal response, 30 units of swelling. This is measuring the mouse's ears with calipers. How'd you like to be the guy that has to measure a hairless mouse's ears in microns? That's another conversation. Anyway, so 30 microns of swelling, or 30, whatever that is, 30 units. The group that got sunburned, so they paint oxazolone on the hind leg, they sunburn the mouse, that suppresses the immune system, they don't treat the mouse, and the IS stands for immune suppression. So the immune response was suppressed by 63.4%. So then there was a group that was treated at 2 hours that had the good, robust reduction in swelling, 0.05, 0.01%. And that group had their immune suppression reduced from 63 to 57%. Well, that's pretty good. That's nifty. Here's the mind bender. The group that was treated immediately with the microcurrent, with 40 hertz on A and 116 hertz on B, had their immune suppression reduced by half 2 weeks after the frequencies were applied. Now, of all the data we're going to see, and there's some more pretty impressive data coming up, this one is the most mind-boggling. It took me 10 years to figure out what a wow this is. Think about that. A single 4-minute application of one and only one frequency combination changed immune system response permanently. That's a big thing, right? Wow. Now, what does that mean? It means when I treat somebody with Crohn's disease or irritable bowel or even asthma, it is not a completely unreasonable expectation to put that patient into remission in 1 or 2 treatments. It's just not that hard. And this is why. If the frequencies are changing signaling in immune system cells and you change the signal, what happens 2 weeks later? Nothing turned the signal back on. So, LOX and COX inflammation are associated with all degenerative conditions: asthma, COPD, irritable bowel, Crohn's, acute and chronic pancreatitis, ulcerative colitis, liver disease, rheumatoid arthritis, and degenerative arthritis. Okay? What would happen if you could reduce all of the inflammatory cytokines in 90 minutes? There is no known medical way to do that. And then what would happen if they all stopped in the normal range? So this is the paper. In 1999, I treated my first fibromyalgia patient who had fibromyalgia secondary to spine trauma. She had an auto accident, developed full body pain 1 to 3 months after the accident. This was 14 years later. Her pain level had never been below a 5, was an average of a 7, often hovered between a 6 and a 7 on a scale of 1 to 10. I treated the first one in 1999. At the end of 99, I had 25 of them. At the end of 2000, I had 50 of them. And this is published 54 consecutive fibro patients with a history of trauma. That means I didn't leave anybody out. It means I didn't get to just pick the ones that responded. It means they all responded. 9 years average chronicity. And then I took this first group of 25 and presented them at, let's see what the next slide is. Yeah, and presented them in a case report at the National Institutes of Health. So Jay Shaw is a physiatrist there, and he knew me from my myofascial work, and he said, I got an opening in February, I've got no speakers, do you have anything you want to present? And I said, I would love to present these fibro cases, because I need help. These patients come in at a 7, they leave at a 0, and nobody's going to believe it. It's one frequency combination that does it, 40 hertz on channel A, that's a frequency to reduce inflammation, 10 hertz on channel B. When you read the published paper, it says it was trial and error. No. No. It was reduce inflammation in the spinal cord. Their pain goes from an average of a 7.4 to a 1.3 in 90 minutes. And so I presented this data. Now, what do we say? There was 58% of them recover in 4 months from fibromyalgia. This disease this condition is incurable. And it affects, this particular type of fibromyalgia affects 28% of fibromyalgia patients in the United States. As a rough guess, it's probably closer to 35 or 40%. But it's about 2 to 3 million people in the United States have pain level between a 7 and an 8 that never goes down. And we just took them from an average of 7 to an average of a 1 in basically 90 minutes. So I presented these cases. Now, to get them to recovery, they need to keep their pain down below a 4 most of the time for 3 to 4 months. So that's FSM in the office. They had a home unit that was made by Rehabilicare at the time. I would send them for physical therapy, reconditioning, supplements. I ordered a fair number of facet blocks and epidurals, injections. When I couldn't get it done, my job was just to get it done. I didn't care who did it. So Roy Slack was great with a needle, and so he would inject them. IBS, irritable bowel, adrenals, interstitial cystitis, and they got better. So I presented these cases at NIH, and Terry Phillips, and I said the end of it, I said, okay, I've done this 25 times. Nobody it doesn't work on, and nobody's going to believe me unless we have something objective that you can measure. And we have thought of everything I can do in the community, and there's nothing we can measure that's objective. Terry Phillips comes up, he's this tall British guy. And he said, you send me a spot of blood on blotter paper, and I'll tell you what they had for breakfast. I went, okay, so he sent me the blotter paper, I got the blood spots. And a month, 6 weeks, 8 weeks later, I'm literally heading out the door of the clinic to catch a plane to go present this data at the Institute for Functional Medicine International Symposium. So, and the fax machine goes off. So I grab these 2 sheets off the fax machine, and it's got a table with all of these symbols on it and all these numbers, and the numbers look pretty good, like the numbers look like that. And I walked into the hotel, and it's like, this was 2000, this was before Google. You couldn't Google this. I didn't have a medical school library between the hotel, the airport and the hotel. So Jeff Bland is the guy who started the Institute for Functional Medicine. He's walking out of the hotel. I said, Jeff, I have this data. I just got it from Terry Phillips. And he said, yeah, let me see. And he looked at it, and his hand started shaking. I said, is it good? He said, you are going to knock their socks off. I said, I'm really glad you think so, but I have no idea what cytokines are. I don't know what they do. Are these normal sorts of reductions? He said, call Michael Ruff. He and Candace Pert published Molecules of Emotion. He is recognized to be one of the experts in cytokines in the country. Give him a call. He's still in the office. Okay. So I called Michael Ruff, and I said, Dr. Ruff, this is Dr. Bland, Dr. McMakin. Dr. Bland said to give you a call. I've got this cytokine data, and I really don't know if it's significant or not. And he said, okay, what are the numbers? I said, well, interleukin 1 goes from 392 down to 21. And the other line got really quiet, and he said, what time frame? I said, 90 minutes. And it just went, Dr. Ruff, are you there? And he said, that's not possible. Cytokines are hard to change, and when they change slowly. And being perky and otherwise ignorant, I said, yeah, no, they're not. They're all changed like that. He said, what are you talking about? I said, well, interleukin 1 went from 392 down to 21. TNF alpha went from 299 down to 20. Interleukin 6 went from 204 down to 15. CGRP, interferon gamma, all of the inflammatory cytokines dropped by factors of 10 and 20 times in, 10 and 20 times in 90 minutes. So we go to the reception that night, and David Perlmutter's there. He's written Green Brain. He's a wonderful neurologist, good friend. Well, I've never been on his boat, but, we say hi. And David says, well, does substance P change? Because substance P is made in the spinal cord, and if you change substance P, it means you are changing spinal cord function. And I went, funny you should mention, substance P went down from 132 down to 10. He said, well, you're changing the spinal cord. The other thing that happens with these patients is that around the 30-minute mark, they get immediately, inside of 10 minutes, their blink rate slows down, they get kind of drowsy. At the 30-minute mark, they really don't want to open their eyes. At the 40-minute mark, you can wake them up, but they'd really rather you just left them alone. So endorphins go up, they just get stoned. I mean, there's no other way to say it. They're just like, dude. We call it the dude effect. So endorphins go up from 5 to 88. Cortisol goes up, and somebody thought it might be a stress response, but cortisol goes up because if you're going to raise endorphins by 10 or 20 times, you're going to raise ACTH, which is cortisol stimulating hormone, and it's not a stress response because neuropeptide Y, which I didn't publish, goes down. So the data is consistent. We are doing something profound to change immune system function and inflammation and pain conductivity in the spinal cord. Pain level went from an average of a 7.3 to a 1.3. This is one patient that she had a disc that was compressing her spinal cord. She actually got a headache, and so her pain didn't go down much. But even with her as an outlier, the 7.3 to a 1.3 in 90 minutes in that group with that kind of chronicity, the p-value has 3 zeros. Now it actually has 6 zeros. But the statistician was British. And I said, well, if it has 6 zeros, why aren't we publishing 6 zeros? And he said, anything more than 3 zeros is just showing off. I went, okay. So when we first started submitting the paper, it was called Resolution of Fibromyalgia Associated with Spine Trauma. We submitted it to 4 different journals. We were rejected 4 different times. The 5th time, we retitled it Cytokine Changes in Fibromyalgia Associated with Spine Trauma, and Leon Chatow published it in JBMT. 58% recovered. 13 out of 53 discontinued treatment for reasons that are not related to treatment side effects. That means that they had most of them had 1, 2, 3, or 4 sessions. Every single session, they were out of pain at the end of it. And they stopped coming in to get treated. So here's one for you. It's like it feels really good, it sounds really good to get people out of pain. If you've been in pain for 17 years, and your pain goes from a 7 to a 0 in 90 minutes, who are you? We create with frequency-specific microcurrent, honestly, an existential crisis that is unparalleled in medicine. If it took 6 weeks for the pain to go down, it'd be easy. They could get their head around that. But to go from a 7 to a 0 in 90 minutes, it's like you don't know who you are. And in 1999, 2000, 2001 even, I wasn't very good at helping people with that. We're better at it now. Warn them ahead of time. This is a patient who was 18 years chronic. She had 14 out of 18 tender points in December, 11 out of 18 tender points in January, 7 out of 18 tender points in February, and at 6 years, so she had recovered. She no longer met the diagnostic criteria for fibromyalgia. At 6 years, her recovery was maintained. So fibromyalgia is curable. It's the most important thing you need to know about it, but you have to fix how they got it. So only 30% of them get it from spine trauma. There's another bunch that get it from organic chemical exposure. There's another bunch that get it from just chronic prolonged stress. There's another bunch that get it from getting vaccinated, go to China. Okay? So there's a function, there's a slide missing. Did we put that slide in there? Okay, I'm going to do this now because it has to do with inflammation. Let me see if it's here. Nope. Okay, this has to do with inflammation and it's important. So I want you to, because when you talk about the resonance effect and you talk about frequency-specific therapy and you talk about frequency medicine and energy medicine, people get all sort of dewy-eyed, all sort of, wow, if my intentions are pure, everything's going to be fine. Yeah, no, not so much, okay? So there is a precaution that goes with that frequency that reduced inflammation in the mice, 40 and 116. You get to think about it, and we found out about it experientially, like by doing it and creating the problem. So your immune system uses inflammation as a way of corralling and sequestering infection. Where am I for time? Okay. Corralling and sequestering infection, okay? If you turn off inflammation, and if you think about the frequencies as turning inflammation off like you would with a key fob, if you turn off inflammation, we just slam it down by 62%, and it stays down for 2 to 4 hours. If you have an infection, the frequency will override bacterial signaling that tells the immune system to protect from infection. The frequency overrides bacterial signaling. That's a whole nother, but that by itself, wrap your head around that. So, infection is present, we turn off the immune system. 4 hours later, when the immune system goes back on, the bacteria have had 4 hours of party time. Yahoo! And when the immune system comes back on, the infection is worse. So this frequency, the frequency to reduce inflammation, that one, that frequency to reduce inflammation, 40 and 116, 40 in any frequency, 40 in any tissue. If it reduces inflammation and the patient has an infection, it'll get worse. This is the most powerful frequency in our armament, and it is also the most dangerous, okay? We don't sell machines to people who haven't taken courses, and this is why. It is a black box warning in my textbook. It is every time inflammation is mentioned in the resonance effect, it's there. Because of this, and I don't know where that slide went, but this is the place where you want to see it. So functional medicine, I don't know, anybody here familiar with functional medicine? Okay, it's basically a systems biology approach to medicine. Well, you warned me it might crash. No, seriously? Okay. What do you want me to do? I don't sing that well. Y'all can, there we go, you did it. Way to go, dude. Come on. So functional medicine is a systems biology approach for chronic medical problems. FSM works immediately, so using diet, lifestyle, and supplements to change the milieu, to change the way your gut functions, to quiet down your immune system, to fix why you have the problem. If a functional medicine doctor sees you for asthma, the first thing he's going to do is take you off wheat, fix your gut, and give you probiotics. Why? Because 85% of your immune system is clustered around your digestive tract, and your immune system just decided that your bronchi belong to somebody else, okay? So functional medicine works well, but it takes too long and it costs too much. FSM works immediately to reduce, what did I do? To reduce pain and increase ATP, but it needs functional medicine to create lasting and stable improvements. So I can work on somebody that has pain, and if they won't exercise, won't drink water, won't take magnesium, won't change their posture, I can do whatever they want, whatever I want, and it'll last 24 to 48 hours, and 3 days later they're back where they started. You have to have a stable state into which these changes can last. Nerve pain. Anybody here ever had sciatica or nerve traction injury? It is so not fun, right? Muscle pain, scar tissue, problem in medicine. Well, the treatment doesn't work very well, the short version. Takes too long, costs too much, and it doesn't work well, okay? So, neuropathic pain, honest to God, I swear, it's the easiest thing we treat. 40 hertz on channel A to reduce inflammation, 396 hertz on channel B to treat the nerve. Polarize the current positive, set your watch, come back in 37 minutes, and the patient's out of pain. It's just not that hard, as long as, you know, the nerve hasn't been crushed or cut or the disc isn't sitting on it. So I finally got 20 cases together to publish. Average chronicity was 7 years, so this wasn't, you know, the kind of disc bulge and nerve pain that was going to get better in 3 months by itself. All patients experienced pain reduction, every single one of them. First treatment, they came in at a 7, left at a 2. Second treatment, they came in at a 5, but left at a 1. And 65% recovered in 5 sessions. And this is with 7-year average chronicity. No adverse reactions except for that thing where they get stoned. We don't charge extra for that. It's just part of the service. We make sure you're okay to drive when you leave the clinic. What's interesting is the same problem, 25% terminated care prior to recovery. If you've been in pain for 7 years and you're out of pain at the end of 60 minutes, who are you? You know, it's a thing. Myofascial pain, this is where I started. These first cases were published in 1998. 50 cases, they came in at 5 years average chronicity. The range was 1 to 28 years. 88% failed with other treatments, so we figured they served as their own controls. They were going to have a placebo response. They would have had them with, you know, one of the 6 other people that treated them before they got to our clinic. 11 visits in 8 weeks. Pain was a 7 when they started and 1.5 when they left. And the only reason it took that long was I didn't know what I was doing. I kept thinking that muscle pain was because of muscles, and it's not. In the cervical spine especially, you have to treat the facet joints, the posterior joints, the discs, and the ligaments, and the nerves, and the spinal cord. Muscles are a piece of cake. So that was that one. With the lumbar cases, we got lucky. 8 years average chronicity, 2 months to 20 years, 87% had failed with other treatments, 6 visits in 6 weeks, and to get them from a starting visual analog scale, 7 out of 10, down to a 1 out of 10, okay? So myofascial pain is sort of our bread and butter. I didn't find out until I went to present these data at American Back Society in December of '97. Presented this 150 cases. And I heard one of the podium speakers tell the group that myofascial pain was psychiatric because it was so hard to fix. I went up to the speaker and I said, no, it's not. About 97% of the time we can fix it in 6 visits in 6 weeks. So muscle pain's easy. This is a burn research project we did at the Burn Center, Springfield, Missouri. These patients, there were 8 patients I treated an hour a day, 3 days in a row. The PTs and OTs measured them on Monday and Friday. I treated them Tuesday, Wednesday, Thursday, all except one patient. There were 8 on Tuesday, and I doubled this guy's range of motion in his knee and his hip. It was an industrial accident. And at the end of the hour, he said, what is going to happen to my settlement if you make my range of motion normal? He didn't show up on Wednesday. But the rest of them, We're a cautionary tale. Anyway, every patient had statistically significant permanent increases in range of motion after 3 one-hour treatments. So the use of microcurrent, and we used Silverlawn as a conductive thing on top, inside of their compressive garments. I don't know if you have access to that wherever you live, but if you're ever thinking that you're having a hard day or you're having a problem, just go sit in the burn unit for a week. You don't, or even a day, half a day. It was never the same after that. It's like it kind of puts everything in perspective. One guy, his goal, his treatment goal was to be able to hold a coffee cup. So the take-home messages from that burn center project was never deep fry anything on a gas stove, ever. Okay? Never work on your own cars. Let somebody else do whatever they're going to do with the carburetor. Those were my two. And don't ever burn your trash in a burn pile if there's a hairspray can in it. That was the take-home message from that. But to be able to increase their range of motion, one guy, to get his head from here to here. One guy, as I'm working on his hip and his knee, the nurse came by and watched what I was doing, and she said, if you work on his ankles, if you can get his ankles to 100 degrees, we can get him in a brace and get him out of the wheelchair. So the next day his ankles were at 115, or whatever normal is. It just was fine. Abdominal adhesion research. David Wiseman is a PhD researcher at Baylor Medical School, and he's developed a technique for creating abdominal adhesions in a rat. He opens the rat up, he takes like a little teeny fine cheese grater, and he sort of abrades the abdominal wall, and he abrades the rat's cecum just enough to kind of make it a little bit glowy red, and he puts them together and puts a stitch in it and closes the rat back up. And the next week, when you open that rat back up, you have got an adhesion that is almost cartilaginous. It is hard, it is white, and you have to cut it with scissors, surgically. Scalpel can't get through it. So it's one of those. It is the kind of tough scar tissue you see in patients with endometriosis and Crohn's disease. So he got permission for us to do these 3 rats, and I had this list of like 5 or 6 frequencies we wanted to do to treat the scar tissue. So he opens the rat up, and and we snip the stitch, and I put the contacts on either side of the rat's abdomen, and I ran the first one. Nope, nothing happened. Second one, 5802. Nope. 5832. Nope. Scarring is 13, and the fascia, like the abdominal wall, you could think of as being kind of a specialized kind of fascia, right? Now, David, mind you, has got the cecum, the rat cecum, in forceps, and he's just holding it. And I ran 13 hertz on channel A and 77 hertz on channel B, and this white cartilaginous adhesion literally turned clear and turned to snot. It just liquefied. I was pulling harder. No, you weren't. Let's do the next rat. All 3 rats, that one frequency, liquefied scar tissue. The next day, we treated 8 patients with an average 15-year chronicity of abdominal adhesions and pelvic pain, and those patients had the same response. So I've been told I got 5 minutes, so we're going to talk really fast. Oh, there's the scar frequency precaution. The frequencies dissolve scar tissue. They're very useful in chronic problems, but if you use the frequencies to dissolve scar tissue when a new injury is less than 6 weeks old, you will undo weeks worth of healing and make a new injury worse. As much healing as we handled, as we did in Terrell Owens in 4 weeks, everything was healed to fluoroscopy on X-ray. I didn't use this one set of scar tissue frequencies until we got to Jacksonville. If I took out too much scar tissue, I had no time to put it back. So there is a precaution that goes with the frequencies for scarring. When you use it with manual therapy, that's Kim Pittis, and that is an Olympic swimmer. So we use frequencies to do all of this. They are very specific. Oh, and it's really important, I think, to say what we can't do. I can't put tissue back that's not there. Torn ACL is a torn ACL. But partial thickness rotator cuff tear, 2 hours, 4 hours, a couple of weeks of PT and it's done. What we don't do, what we won't do, so this is what we can't do, this is what we won't do. We do not treat cancer with frequency-specific microcurrent. Arlene Lennox did a study at Fermi Labs in Chicago and determined, testing another piece of equipment that did a sweep of frequencies, determined that patients with active tumor did not have tumor growth when they were being treated with microcurrent. She used an acuscope to increase range of motion and soften scar tissue from neutron therapy. But there is a medical and ethical reason. We don't have enough experience or studies to know if it's safe and effective. If I do something stupid and make your pain worse, it's just pain. You're going to get over that, it'll go back to baseline. If I do something inadvertently and make your cancer worse, we may not have time to get back on top of it. It's just unethical. Patient's terminal, I can keep them out of pain. I can usually get them to live longer and keep them comfortable, but I don't treat cancer. There's a political reason, obviously. Best way to get any treatment method shut down in the United States is to use it or advertise it as treating cancer, and I don't want to live in the Bahamas or Mexico, right? We do treat concussion. Van Gelder treated concussion, the adrenals, immune system, and emotional factors away from the tumor site to treat the patient, not the cancer. So we got the frequencies from Van Gelder, who got them from this machine that was made in 1922. The frequency effect matches the description. Inflammation reduces inflammation, doesn't do anything for range of motion. Frequency to dissolve scarring, increases range of motion, does absolutely nothing for inflammation. Hemorrhage stops bleeding and pain in the menses and stops bruising. You want to stop a bruise, you just put the frequency on it to stop hemorrhage, and you don't bruise. Mineral ion deposits, there's one frequency combination, the only thing it's good for is shingles and oral and genital herpes in the active stage. All I can figure is we're blowing up the virus. Kidney stone pain, there is one frequency combination, 20 hertz on channel A, 60 hertz on channel B. Takes down kidney stone pain in absolutely every case, but it's not good for anything else. So this is a frequency-specific response, and we're talking by 2005, I was 30,000 patient visits into it. I lost count after that. This is the shingles case report. One frequency combination, 4 hours of treatment. This is ophthalmic branch of 5 in an 85-year-old man. Anybody that knows anything about shingles knows that they published this case because this is impossible. 85-year-old man will develop postherpetic neuralgia, and that is what he will die with or what he will die of. Lesions were gone in 48 hours. It was two-hour treatments. So here we come to the mechanism, and this group, you guys probably have a better appreciation of this than any group I talk to. Basically, the human body is a quantum biological system. Living tissue is biochemicals, right? What are biochemicals? Well, they're molecules. Got it. What are molecules? Atoms. What are atoms? Subatomic particles. Okay. They are held together by electromagnetic bonds. Now, we all know that Newtonian physics holds together as long as you're dealing with large bodies. When you get down to the atomic level, Newtonian physics falls apart. So we're talking about a quantum appreciation. But even if you get above that level into the macro level and you look at how these biochemicals are held together, every bond that holds these molecules, atoms, and subatomic particles together has a frequency at which it resonates. Your body is an electromagnetic system that looks solid, but cells function as a semiconductor network. You're 85% water, and that water does not float anywhere. It is organized, and it sits on this gel matrix inside and throughout the cells and turns your body into what is effectively a semiconductor because of what the hydrogen atoms do. They flicker, and they put a hole in exactly the same place because everything's held on this matrix, right? It's all there. And it is a water version of silicon or germanium. All you need is a hole, okay? So if you're a semiconductor, what do? You convey current, charge, and information. So resonance explains the immediate effects. When we dissolved that scar tissue in the rat, it liquefied in 5 seconds. It was instant. When you treat somebody for inflammation, they get stoned pretty quickly. The gloves get warm, okay? The effects are immediate. Resonance is the tendency of a system or a bond to oscillate at large amplitudes in response to small inputs of energy or information. You all know the scene where the opera singer Julie Andrews and Victor Victoria, if you're old enough to remember that movie, right? Some of you are. Anyway, that trick works not because of volume, but it works because of precision. The frequency that binds lead atoms together in a matrix is within the range of the human voice. That trick works because of the precision of the frequency and the degree to which she holds it. You get the frequency right, the lead atoms start to vibrate, and they simply come apart because they're vibrating too much to Tacoma Narrows Bridge. We're going to have to blow past that because he's getting nervous over there. Take my time? Okay. Nobody's leaving.
Q&A too.
Yeah, I'm going to do the Q&A. You'll get your chance. So the Tacoma Narrows Bridge was interesting. The Tacoma Narrows Bridge, I read the details about it. Everybody knows about that story, right? Okay, but I read the details about it in a book on engineering mistakes called Oops. You can find it on, it's like Oops. So that was an oops because they had a new roadbed design. You notice how thin it is? It was flexible, and they thought it would improve the lifespan of the bridge, but it was too flexible. Okay, they called her Galloping Gertie, right? So this storm that came up was not a hurricane. It was not the force of the wind that took apart this bridge. It was just a simple 20 miles an hour, 25 miles an hour coming around the corner, and this flexible bridge got to swaying. The other problem with the bridge design is that the space between the headland and the pylon in the middle and the other pylon and the other headland were equivalent. Okay? So when the bridge started to sway, when the structure hit the resonant frequency of the bridge as a structure, there was a sine wave. I know somebody was there and watched it come apart. So there was a sine wave in the roadbed, and the bridge simply came apart because of resonance. So the membrane receptors, this may be more biology than most of you want to know, but your cells work because there are receptors on the outside of the cell that are connected to the inside directly by kinases and fibers and chemicals that change transcription factors that turn on or turn off genes that change what the cell does for a living. So if you have an infection, this is why your cells turn on inflammation. If you're allergic to wheat and you eat gluten, this is why your cells create an inflammatory response. Okay? It's cell signaling. The receptors reconfigure in response to stimuli, and that changes cell signaling and cell function. So drugs and nutrients, we're all used to that. We have a chemical model. Well, everybody outside this room probably has a chemical model for how the body works. Change membrane receptors like a key in a lock. Vitamin C, vitamin D, augmentin, Celebrex. They land on a receptor, they change they don't go inside the cell. They change the way the cell functions by changing the receptor, and that changes what the cell does. That's how they work. They don't ever go inside the cell, they just land on it and talk to it. Well, the frequencies act as if they are changing membrane protein receptor function and cell function electromagnetically. There is only one frequency that reduces inflammation. There is one frequency, well, 2 or 3, but one frequency that dissolves scar tissue cross-links. There is only one frequency combination that disassembles the shingles virus. You go from a level 7 with lesions, and 2 hours later your pain is a 0, and the next day the lesions are drying up. How is that even possible? Unless the frequencies are disassembling the viral capsid. So the resonance effect was a book they told me to write 20 years ago. And I see, like, in medicine, so my role in all of this is to take resonance medicine, energy medicine, to the medical community. NIH, we have a research group at Walter Reed. Cleveland Clinic, Pediatric Rehab Hospital, Cleveland Clinic Functional Medicine Institute. And so we got the textbook, we got the published papers, we got all that done first. And then this publisher called me and said, one of your practitioners, I have had Crohn's disease for 17 years, and one of your practitioners just put me into remission in 2 weeks. I want to know why I haven't heard of you. I said, well, it's the best kept secret in medicine. He said, would you like to fix that? So he got me to write this book, and it's the story from the beginning, if you want to know how the frequencies work, where they came from. And I am determined, like I can't get a textbook published on the visceral effects, asthma, irritable bowel, Crohn's. I don't have enough published data for that. We don't have enough science to be able to publish a medical textbook. But if something happens to me, I want the frequencies to be out there so they're available. So the last 2 chapters in this book are all of that. All those protocols are in that book. I'm not about selling boxes. It's not about the box. Thank you. I want it out there. So, hang on. That's the textbook. So we have the textbook and the resonance effect. It's a 4-day seminar. Once you do that, this is our seminar schedule for the next 6 or 8 months. And these are my goals, to reach everybody who wants to be helped by training practitioners who can treat them, and to practice, promote, teach, research, and write about FSM in such a way that it thrives. Okay? That's our goal. And this is a warning for those of you that want to take the class, that go and read the books. It changes your life forever. Once you know this, you can't unknow it. Once you do what you do with frequencies applied in a very specific and particular way, you don't ever get to not know that again. And it is fascinating. And I really love talking to people that understand it from the inside out. So thank you very much. That's it.
Thank you very much, Dr. McMakin. We have Q&A. We also have food available next door. So take your pleasure.
I've got 2 questions, actually.
Hang on, let's turn the mic on.
Yeah, I've got 2 questions. One, I'd really like to know how you are being received in the medical community.
How what?
How you are being received
Okay.
in the medical community. That's one of the questions. And the other is, you didn't talk about PTSD.
Oh, right.
And I would appreciate hearing about that. And addictions, which is something that I deal with. Anxiety,
Thank you.
depression, addictions, PTSD.
I was pushing the limits with this in terms of number of slides anyway. There's a protocol that we use called the Concussion Protocol that Harry Van Gelder developed. Treats the medulla and the pituitary, and it's sort of baseline. Then one of our practitioners in 2004 took the class. She's an MD, but she had a postdoc in neuroscience, and she understood PTSD from a neuroscience, like what actually goes on in the brain, what parts of the brain change. Well, in the frequencies, there are frequencies for all the parts of the brain. So she wrote this program for PTSD in 2005. She'd already used it on 5 patients, so I started teaching it. We now have, I don't know, I keep training clinicians, and the clinicians don't write papers. So we have all of these case reports that just go nowhere because it never happened until it's published in a peer-reviewed journal. So the PTSD scores in general go down by the data we have. Well, let's go back. PTSD, once you've had it for 2 years, that's what you have. It improves in the first 2 years with certain types of medical approaches, hypnosis, whatever. But what you have at the end of 2 years is what you have. So all of the PTSD patients we have data on are 5 to 7 to 10 years chronic. So no improvement is expected. PTSD's threshold score on the paper test is 50 out of 85. These guys came in at 85 out of 85, 85 out of 85, 77 out of 85. after 4 sessions, and the recommended protocol is 8 sessions. So after 4 sessions, they went from 85 out of 85 down to 60 out of 85. At the end, and I finally treated my son's best friend last year, and his story is in the resonance effect. It's in the book. He came back from Iraq or Afghanistan. He was a medic, and it was his job to haul the bodies back in the morning. And he came over 4th of July of 2014, I think, or 15, 14, and pulled it just to say hi. It was fireworks. Pulled into the driveway, and he got out of the car, and he was crying, and he could hardly walk. So I took him in the house, and we ran the concussion protocol on him, and the crying stopped, and the shaking stopped in about 3-4 minutes. So this last year, I treated him for PTSD. His scores after 7 years were 75, 78. After 8 sessions, and I treated him with a magnetic converter that converts the electrical pulses into magnetic pulses, and he put the magnetic coils in his pockets, and we ran it with a custom care, one of our little programmable units, and we watched Harry Potter movies. And at the end of 8 weeks, his PTSD score is 32. The second session, he stopped having nightmares. Third session, he stopped using pot, stopped drinking, stopped losing it. Totally different guy. We count 4th of July as our anniversary. Yes, ma'am?
Sorry, what frequency was
Use the microphone, please.
Oh, the question is what frequency was it? And it's not. It's a 2-hour and 15-minute protocol, which is one Harry Potter movie. So you're treating the forebrain, the midbrain, the amygdala, the thalamus, even the cerebellum, the medulla, which is the reticular activating system, and the cortex, which perceives threat. So it treats all the brain parts and the sympathetics and the adrenals.
Oh, I see.
Yeah.
With different frequencies.
Yeah, so you use those frequencies. And then the other question is, how are we received by the medical community? It just depends. When I go to the American Academy of PM&R, physical medicine and rehab, I've stopped going to the American Academy of Pain Management because they want to do blocks, which is how they make money, and they prescribe opiates. Or they prescribe the drugs that help you get over opiates. Either way, they just don't get it. The PM&R docs want to get people better. They're rehab docs. And so when I say I can double somebody's range of motion in 15 minutes, 20 minutes, 30 minutes, that means something to them. So our best response has been at the PM&R community. Functional medicine people love us. Probably a third of, I'd say it's a third of our practitioners are functional medicine docs. Because what you do with functional medicine takes freaking forever. It takes 4 to 14 months. We can get it better in 12 weeks, not 12 months. And so it's just a perfect meld, and they're already used to thinking outside the box because they hang out with Jeff Bland. So the answer is it depends. We have enough science now that if I show somebody the cytokine data, I don't get a lot of grief.
Well, just in Canada, we have a huge opiate crisis. So, and often from pain management. So this is a very big deal.
It is a very big deal.
I don't know what that issue is here, but in Canada, it's huge.
I'm beginning to suspect that's another conversation, probably requires adult beverages. By the way, we're going to do a demo tomorrow across the hall, and it is my intention to run frequencies through the whole group. If you all hold hands, it's going to be kind of a kumbaya moment. Nobody has to sing, though. And we will run a very specific set of frequencies through the whole group. And some people will feel a lot, and some people won't feel anything. Some people will get stoned. Some people will wonder what we're talking about. But that's part of the plan for tomorrow. I don't tend to treat pain patients, but if somebody's simple, like has just a little impingement or something, we can do a neck and shoulder and get that done. Because I think tomorrow's an hour. Is it an hour? Hour and a half? Yes? Okay, hour and a half. Yes, sir.
So, thank you. That was a great talk, very exciting. I think we're all kind of turned on. And even without the frequencies, right? Just your enthusiasm. So anyway, my question has to do with the origin of the frequencies, and you talk about the original book back in the 1920s, and I have a picture of Abrams' work. Mm-hmm. Well, Abrams used radionics, and radionics uses rates, not frequencies as hertz.
Right.
I assume you're broadcasting frequencies in the hertz range, in which case you may not be, I'm asking, well, what I'm saying,
Yeah.
I don't know what I'm saying, is that you're using frequencies that are not hertz, and you're converting them to hertz. Is that
No,
way to do
I
that?
put Abrams' picture up there because I have a picture of him, and it gives kind of that 1920s flavor to it. We got a list of Abrams frequencies out of the back cover of a copy of ElectroMedical Digest that was published in 1927.
Electromagnetic Digest.
Abrams was selling a poster. So on our summary sheet, there is that list of Abrams frequencies. The ones that we find most useful from his list are pus and pus encapsulated, whatever that means, fermentative and putrefactive toxin, and inflammation. 40 hertz was a frequency for inflammation. And I've heard that said before, they weren't frequencies, they were vibratory rates. Well, someday we can have a discussion about the difference between a vibratory rate and a frequency. And I got to tell you, I've managed to teach this for 20 years and literally have never used the R word in front of a medical audience or any audience, the R word being radionics. Radionics is quackery, everybody knows that, right? Okay? But the way we learned about this, Harry practiced radionics. He would treat people at a distance.
And it works.
So, that creeps people out, though, so they don't get the whole magnetic field circling the Earth. And my field is going to go through your machine and be linked with my picture or blood spot or hair or whatever. But the list that came with Harry's machine, the thing that I don't understand is how somebody in 1922 figured out or decided that the frequency for the tendon is 191 hertz and the frequency for the bursa is 195.
Oh, that's easy. It was channeled information. Yeah. All right.
Whatever. Sorry. No.
For this group, you can say that.
Yeah, I've seen channelers, they aren't that specific.
They can be.
So,
yeah, they can be.
Yes, I'm just not even going to go there.
Oh, okay.
So I don't know how they developed it. I mean, I'm a clinician, so when I went into the Oakland Raiders training room and Keith Pine was working on one of the players that had